Lorie Out Loud.
If you've been enjoying the conversations, the stories, and the unique experiences we highlight each episode, I'd love your help with one of my most important goals. I'm working to grow my YouTube channel so I can take Lorie Out Loud to the next level. And one key milestone is reaching 1,000 subscribers to qualify for monetization. Did you hear me? I'm trying to get paid. If you understand the mission, please take a moment to subscribe to the channel at Lorie Out Loud. Turn on the notifications and share the channel with someone you think would enjoy the content. Your support helps keep this platform going and ensures that I can continue bringing thoughtful, creative, and meaningful stories to a wider audience. Thank you for being a part of this journey. Now let's get back to that episode. Hey, beautiful people. Welcome back to another episode of Lorie Out Loud, the podcast where voices get amplified, culture gets celebrated, and creativity takes center stage. I'm your host, Lorie Jean Akanbi. And in today's episode, we're stepping into our Science Me segment to explore the powerful, personal, and often misunderstood world of lactation. Joining us is Sonja Howie, a dedicated registered nurse and IBCLC certified lactation consultant who spends her time guiding new parents through the early stages of infant feeding with skill, empathy, and evidence-based care. Sonja breaks down breastfeeding, shares real-world insight from the bedside, and helps us understand what it truly means to support families during one of the most vulnerable and beautiful times in their lives. So, whether you're a parent, a caregiver, a healthcare professional, or just curious about the amazing ways our bodies care for new life, this conversation is for you. Let's get into it. Welcome to Science Me, where we explore the science that speaks to us and centers our stories. This isn't your typical science chat. We're here to break down the facts and the feelings, to talk about health in a way that's honest, inclusive, and empowering. Today, we're getting intimate with a topic that's as natural as it is misunderstood: breastfeeding. To guide us in this topic today, I am honored to welcome a powerhouse in maternal care, Sonja Howie. Sonja is a lactation registered nurse, board certified lactation consultant, and a proud maternal newborn nurse. With a calm confidence and clinical precision, she supports new mothers and babies from those first tender moments of birth through the often unpredictable breastfeeding journey. From working at the bedside to managing complex outpatient cases, Sonja is a compassionate force in postpartum care with deep expertise in milk transfer evaluation, infant nutrition, and individualized lactation strategies. And guess what? She's not done yet. She's currently on the path to becoming a nurse practitioner, expanding her ability to impact families even further. So grab your notebook or your nursing pillow, because today we're going beyond the nipple shield. We're talking lactation, advocacy, and science with heart. So I'm going to dive right into the first question, and that is, Sonja, what first drew you to nursing, and more specifically, to postpartum and lactation care?
So, good question. I knew I always wanted to be a nurse ever since I was a child. I got my first aid kit, and it kind of grew from there. Kind of made my way into the field. It took a little bit of time, a little bit of bumps along the way, but I did make it. And I got the opportunity to interview for a postpartum position, and I took the chance. Working as a CNA 9 years prior to that, in various fields. I kind of want to segue into the maternal health world. And I got the position, loved mother baby, but I found that I really was drawn to lactation care, really helping mothers learn how to breastfeed their babies. But I found that I wasn't able to spend that quality time with them that I wanted to with the other, basically things I need to do as a nurse. So, medication, other responsibilities. I wasn't able to really dive in with them as I wanted to with lactation. So I did segue to become a lactation nurse. And now I get to spend all day teaching moms how to breastfeed and educate about, common myths and misconceptions of nursing and things such as that.
Can you talk a little bit about, you talked about, what you did before nursing. You mentioned you were a CNA for 9 years. Like, what types of things did you, areas or specialties did you work uh, in that particular area?
Yeah, so I started my CNA journey in 2010. I started on the digestive health unit, and then I moved to intermediate care unit, neurovascular ICU, then went to Florida, worked in another neurosurgery unit, and then the PDR. Then I also worked as a phlebotomist too, cardiac, spent a little bit of time in the nursing home. So I kind of done it all. Honestly, I've seen various aspects of the nursing world. So I feel like seeing that aspect that kind of led me more to the maternal health world once I did become a nurse.
Yeah, yeah. So you just kind of describing the journey that you went on. So you just didn't jump into, being a postpartum or a lactation nurse. You had these other avenues that you kind of went through before you kind of decidedly settled upon that. Now, you've worked in both inpatient and outpatient settings. How has each experience kind of shaped your philosophy of care?
So inpatient, specifically speaking, I'll speak to postpartum, where, right after you have a baby, you're 1, 2 days out because we take care of patients from birth to about 3 or 4 days old typically. So it's more like learning to breastfeed, things such as that. And then outpatient, we see patients, I've seen patients, and mothers and children as old as 9 months old. So it's some of those difficulties that pop up that can arise once they're out at home and things like that. Those feeding challenges. So as far as that question of philosophy of care, I'm gonna have to think about that. I guess inpatient is more immediate, right? We're just trying to quickly
Yeah.
educate, and then typically um, how I educate patients is that we have time to figure this out, right? So don't feel like you have to get breastfeeding down these couple days that you're in the hospital. Come back to see us. We'll work on it at that time. Here's the plan of care until that point in time. They'll schedule an outpatient, and then we'll delve into those, maybe latch concerns, pumping issues, things such as that. So I think patience is really what it is as far as outpatient. Really working on those really takes a lot of critical thinking with the outpatient cases because they're
Mhm.
just it's just so vast how much different they can be. You don't know what you're going to get when they come back, 6 months, 6 weeks, 4 months out from delivery versus, you know, newborn as far as like 1, 2, 3 days old.
Yes. So
Yes.
let's get into the science of it. Like, what is really happening with your body during lactation? And why is the latch so critical?
So as far as lactation is concerned, once you have a baby, once your placenta is delivered, that tells your body to go into lactogenesis 2, which is the copious milk production, your second milk. Which a lot of people, sometimes they're under their misconception once they come to the hospital. They're like, well, my milk's not here. I don't have any milk. And sometimes they're thinking that, their breast should be full, leaking, kind of what they see on TV, but that's not the case yet. It takes a couple of days for that to happen, just depending on circumstance as far as delivery, things like that. So just some of the education that goes into that. The latch is very critical, and I always try to educate my patients because breastfeeding should never really hurt. And sometimes patients get from their family members that it should hurt, or some misconceptions such as that. And typically it doesn't hurt. I always say it can feel a little, maybe a little pain initially, and that's the initial latch on pain, but that should subside within about a minute or so. But after that, it should just feel like pressure. You shouldn't feel any pain. So that's the part I really try to help moms learn: positioning, latch correction, how to look and assess for a nice wide latch at the breast.
I breastfed all 5 of my children for a minute, and that really is a key point there. If it's hurting, then more than likely it ain't on right, because it doesn't hurt if it's on properly, basically. It just, like you said, it feels like pressure.
And I'll note something else too. Oftentimes too, back when you were breastfeeding, and other moms too, oftentimes they'd stop because of pain, and they'd also feel that it was them that was the problem. Like, oh, I'm not making milk, something's wrong with me. But we've found out that more so it's actually the baby's mouth. There's tongue ties typically present when you're feeling a latch, even though you may see a deep latch, like a nice angle present. But when there's a tongue tie present, that could create some pain. And often moms, there was not that support, how it was, a couple of decades ago, maybe even a decade ago, to really diagnose these issues.
I know with me, I had to quit each time. It only lasted, just a little bit, because I kind of felt like I didn't make enough milk. I wanted to breastfeed, but it's kind of like, just having some concern whether your babe is getting enough milk was really the driver in saying, okay, I'm going to pass on this. And, but tell us about, because I always thought it was important, and it made me feel better. Because the very first, the what is it called before the milk comes in? There's a type of, what is it called? Yes. And so I felt better that I was able to share that with the child, at least, because of course, back then they shared that, okay, well, that had some type of benefit to the baby.
Yeah, the colostrum is your very first milk, and I always educate to the patients that you've been making colostrum since you were 16 weeks pregnant, maybe unbeknownst to you. And that first milk is very precious to the baby. It's a different composition than mature milk, and you'll have that colostrum in your milk for about 2 weeks or so. Once your second milk comes in, that more, volume is breast. Leaking milk, that's your transitional milk, which is a mixture between colostrum and mature milk. But I wanted to point on something else you were saying too, about that fear that your baby wasn't getting enough milk. I heavily educate on that with my patients, because that's the most number one question I get. Like, how do I know my baby's getting enough? So I educate on, pees, poos, weight loss percentage, and weight gain. That's how we can ascertain how the baby's doing as far as breastfeeding, signs that baby's getting enough at the breast, looking at the baby instead of the clock. Some of those signs, because breastfeeding, it's not all quantitative, like, pumping or formula feeding a bottle. Okay, baby needs 60 mLs. Let me give the baby that. Breastfeeding is more about qualitative data, looking at, how the latch is, your baby's response to latching, relaxed baby after nursing, sleeping for a couple of hours, wet diapers, poo diapers, going to the pediatrician, the baby's gain weight, things like that, to help you really know that, the baby's getting enough milk. So I try to provide as much confidence to the moms as possible to let them know that, hey, you can do this. This is the information. Look at these numbers. Look at what the baby's doing. That's how you can know that the baby's getting enough milk.
Sonja, what's the most common challenge new moms face with breastfeeding, and how do you help them through it?
From my perspective, I feel the most common challenge for new moms is just feeling that confidence that their baby's getting enough from them. Oftentimes I find that the moms feel that, they don't have enough milk, the baby's screaming, the baby's hungry, and they just feel that they're not able to feed their baby. So I like to come in and just give them that, offer that support, educate them as far as like, how do you know that the baby's getting enough milk? P's, poos, weight loss percentage. Look for these cues as far as a hungry baby, what to look for, early feeding signs, signs of swallowing, how you can assess that, and things such as that. So just really giving them that, that confidence, honestly.
That's good. That's good. Now, can you break down what a milk transfer evaluation is and why it matters?
Yeah, so that's something we offer in our clinic. So what we'll do is we'll weigh the baby in a diaper before, and it'll need to be a professional scale that's very sensitive, and we weigh the baby in grams. We'll put the baby on the breast. After the baby's unlatched on one side, we'll weigh the baby in that same situation as far as clothing, so it's just in a diaper. And then 1 gram equals 1 ml of milk. So I really like this for those patients that are type A or just really want to know what the baby's getting. So after the baby has nursed, I'll weigh the baby and I'll see exactly how much that baby's transferred. So then also during that assessment, I'll be able to let the mom know, like, look, baby's swallowing, look at signs that baby's getting enough milk. So sometimes, as moms, not even just new moms, as moms period, we're just worried if the baby's eating enough. So I like to empower the mom to feel confident, like, hey, look how much baby transferred. Baby's gulping at the breast. The baby's eating, chugging, eating good. And they feel good after the assessment. I'm like, baby transferred 3 ounces in 7, 8, 20 minutes, however many minutes. So I let them know that, okay, if you're seeing this, coupled with P's, poos, weight gain, then you can feel empowered that your baby's doing well.
Yeah, I think that sounds like it helps to put the mom at ease, for sure. I mean, especially if this technology can help them determine how much milk they got. I mean, that's incredible. Certainly sounds like something that can put a new mom or a repeat mom at ease, for sure.
It definitely does. Oftentimes I, reached out to by mothers and they're not sure if baby's getting enough, especially moms with maybe an oversupply and the baby drinks the milk really quickly, and they're like, the baby won't wake up, because sometimes they're getting education like the baby needs to feed for 15 minutes on each side, and I'm like, watch the baby, not the clock. Look and see what the baby's actually doing. Is it actively feeding? Look at those signs that baby's starting to get full, and I try to relate it back to us. What do you start to do when you get full? You start to, you're still eating, you want to still eat, but you're starting to get a little bit more groggy, more sleepy, okay? So some of those signs that babies are getting full, relaxed posture, things like that. So I just try to relate it back to us as humans. We're all humans, right?
Yeah, for sure.
to just
For sure.
empower them.
Yes. That's good information. Hey, beautiful people. It's Lorie Jean Akanbi, your host of Lorie Out Loud. If you're enjoying the journey so far, I'd be so grateful for your support. You can contribute through Cash App at $Lorie Out Loud. That's $Lorie Out Loud. Every little bit helps me keep going, growing, and sharing out loud. Thank you so much. How do you approach breastfeeding complications like mastitis, tongue ties, or engorgement?
Now, if I suspect something such as mastitis, so as a nurse, I can't diagnose, right? So if I'm seeing the signs that could possibly, that looks to be something like that, I always educate the patients to call their provider if they're seeing certain signs such as, they're having a fever coupled with a red localized hot area, hot to the touch, things such as that. So I empower them to call their provider with that. Same thing with tongue tie. Can't diagnose. I just always like to say what I see, objective, what I'm seeing, and empower them to maybe start to have these conversations with their providers and taking the next steps. And you said engorgement?
Engorgement, yes.
Similarly, I always educate patients before they leave the hospital about engorgement and mastitis, what to do to help manage engorgement, as well as signs and symptoms of mastitis, with a handout too, because we know retention is low after you've had a baby. Sleep deprivation, you're not, eyes are probably crossed while you're listening to me. So I always have everything in a handout you can refer back to. I like to highlight things. And then I like to quiz my patients too. It's just always good for retention. Have a piece of paper they can refer back to, phone number, contact information, to where if they are unsure or want to, just to quickly ask a question, they can give us a call, and I can let them know if they need to contact their provider.
Now, look, I'm asking these questions all readily, but what is mastitis, for instance?
So mastitis is a breast infection. So it's typically caused, typically when I see it, it's caused by ineffective milk removal. It could also be caused by some type of antigen or, virus or bacteria that's entered the body. Actually, it's caused by a bacteria. Could be caused by a bacteria that enter the body, not virus. But generally, I see it in moms that with ineffective milk removal, or at times when their milk starts to come in and their body tries to slam them with too much milk, and the baby doesn't need to eat that much, and the body's trying to give you too much milk, and that milk removal's not there. So it's an infection, and it can really dampen the milk supply. So I always try to say, typically starts with a clogged duct that's able to persist. I don't know if you remember a clogged duct. It feels like a little marble under the skin.
Yes. I've had a couple of infected milk ducts before, so I know. Yes.
Yeah. So I like to educate on that, signs and symptoms, fever, flu-like symptoms, just general malaise, not feeling good. Again, that red.
And heat to the touch.
Yes. So generally, you'll need to call your provider for antibiotics, but also say call your lactation consultant for management as well on the milk side of things, because sometimes moms get worried, like, can I feed this milk to the baby? Things such as.
And thank you for that. Now, what is engorgement?
So engorgement is just when your breasts get full. So I always like to say, after you have a baby, typically your breasts are soft, right? So then as your milk starts to come in, the lactogenesis too, your breasts start to get a little bit more full. So engorgement, I always like to say, it's not always, so when your milk comes in, it's not always milk that's present. It also can be lymphatic fluid. So I like to teach moms breast gymnastics to kind of help walk our breast. Just like after you have a baby.
Walk your breast.
After you have a baby, you know how your feet and your legs are swollen? You walk to help redistribute that fluid our breasts
Yes.
can be so swollen that, and I'm sure a lot of moms out there can attest to this. If you pump, nothing will come out, even though your milk is full of your breasts. Sorry, your breasts are full of milk. That
Yeah.
lymphatic fluid can be pressing down. So I always like to say, let's do some breast gymnastics. So we're gonna move our breasts up, down, left, right, circles one way, circles the other way, and then use ice. Back in the day, not even that long ago, we were using heat.
Heat.
But if you think
Yes.
about it, heat brings more blood flow to an area. If an area is
Uh-huh.
congested, engorged, hard, so
Mm-hmm.
I always like to relate it to chin, nose, forehead. We want to avoid forehead. So I always like to tell moms when our breasts feel like our chin, let's start breast gymnastics to prevent
Yeah.
our breasts from feeling like our forehead. So we're going to move our breasts around prior to each feeding.
Mm-hmm.
And then after, we're going to use ice. So we treat engorged breasts like a sprained ankle. We don't
Mm-hmm.
massage, we don't do anything vigorous. We're not
Okay.
punching our breast or doing anything crazy because that can result in
Uh-huh.
micro tears to our breast tissue, which
Yeah.
further increases inflammation in the breast tissue. So we want to avoid
Yeah.
any of those type of maneuvers. We just want to
Yeah.
kind of move the girlies around, breastfeed
Mm-hmm.
and or
Mm-hmm.
pump, and then
Now, what was the breast gymnastics again? Say that again.
so breast
Is
gymnastics. We're gonna take our breasts, and I will
Mm-hmm.
spare you guys the visual again, but I
Yeah.
will explain it. So we're gonna move our
Yeah.
breasts, and I would say like to say exaggerate the movements: up, down, left, right, circles one way, circles the other way. And generally, when I do
Yes.
this with moms, I'm already seeing the milk starting to come out. Okay, because that's
Okay.
already
Okay.
kind of helping that lymphatic fluid to kind of move out, just like I was
Yeah.
saying with
Mm-hmm.
in regards to after you have a baby, fluids in your feet, ankles, we walk.
Yeah.
We're gonna walk our breasts. And we use ice
Wow.
after.
Now that's good information.
Yeah, breast
That's good
gymnastics.
information. I don't remember getting none of this.
The downside, I see so many, I go in so many rooms and there's so many grandparents present and they're like, "Ah, we didn't have this." And it's just so unfortunate. There's so many moms that could have been helped. With the tongue tie, everyone has a frenulum, which is that, if you can see a string, looks like a string underneath
Uh-huh.
our
Underneath your
tongue.
tongue. Mm-hmm.
Now, a tongue tie is a restrictive frenulum, meaning, so think
Yes.
of the tongue as something fluid. It moves up and down to extract the milk, right? Now, if you have this string here, that's the frenulum. If it's restrictive, and the frenulum could be thick, thin, flexible, inflexible, things such as that, and it could innervate here, 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 wherever along the tongue. So think of it as
Yeah.
mine. I'll just say as far as mine innervates about here, right, and it's thick. So
Yeah.
my lateralization is poor, so it
Yeah.
explains a lot of things, such as why sometimes I have a hard time chewing steak. I never liked steak, right? And or hard foods because I had a hard time chewing them. Even peanut butter, clearing food from my mouth. Same thing with speech. Remember, I had a hard time
Yes.
with my R's. I had to go to speech
Yeah. Yeah.
therapy
Yeah.
because I would say word. I even at
Yep.
times still have issues pronouncing certain words because I still have that tether at the on my tongue. So after a long day of talking, my tongue is fatigued. It's a muscle. So at times
Yeah.
I still, towards the end of the day, I'll still sometimes say like waddle bottle. Sometimes like that. I'm like, oh, my tongue's tired. I've been talking all day. My tongue tied. I've been thinking about getting it fixed. But anyways, you know, I'm telling you, so the tongue tie, it can affect a lot of things, from speech, sleep apnea. I have sleep apnea, CPAP machine. The tongue is needed in so many things. It's fascia too. So if I'm having some tied down fascia here, the fascia is interconnected in our body. So if I'm having some tension here, I often have neck tension as well. So it's just our whole body's interconnected. So
Yeah. Yeah.
again, as a nurse, I can't diagnose tongue tie, right? I can just tell my patients what I see, go to their provider to, get a diagnosis and or refer them to
Yeah.
just educate them.
And
I
that's
just like to educate.
Yeah. That's good information because so you talked about the tongue ties, you talked about the engorgement, as well as talking about the mastitis. And so thanks for explaining those, because as I was reading that, I was like, well, what if you've never heard of this? And so it's good to offer an explanation, and who better to do that than the lactation nurse, right? So you do so much emotional support in your role. How do you help mothers navigate the mental health side of breastfeeding? Because again, you know, if you're, I mean, just again, going back to that, as a mother, you want to provide. And if you feel like you're not providing the basic necessity, i.e., food, then you feel a certain kind of way. And so, how do you help moms kind of navigate that,
Yeah.
the mental side?
Looking for soulful music to spice up your next celebration? Meet the dreaded Blues Lady, your go-to blues singer from Virginia, bringing heart, soul, and a whole lot of power to any event. Whether it's a house party, a birthday bash, or any special occasion, the dreaded Blues Lady will fill the room with music that touches the soul. From performing powerful blues and soul at your events to singing background vocals on your music tracks, she's got your musical needs covered for any project.
I can't be satisfied, and I just can't keep from crying.
Book the dreaded Blues Lady for your next event and bring the power of blues, soul, and inspiration to your celebration. Visit thedreadedblueslady.com or email info@dreadedblueslady.com today.
The Dreaded Blues Lady. Soulful music, powerful stories, unforgettable moments.
Just can't keep from crying.
So I'm one of those lactation consultants. I just always tell moms to give themselves grace, right? I'm not someone to say, don't use a passy, don't do this, don't do that. I always tell them, choose your sanity first. Choose your mental health first. Take it one feed at a time. You know, if I go in a room and I notice that, you know, it's hard for me to even latch the baby, or I can sense that the mother's frustrated, kind of say, let's reel it in, okay?
Yeah.
We'll come up with different plans. I like to do maybe pumping at night, practice breastfeeding during the day, still to get that stimulation at nighttime, but to practice when you're fresh in the daytime. And I got that from one of my colleagues, Helen. She's great. She's since now retired, but and that makes sense. You know, she always said, we don't practice piano at nighttime, do we? When we're practicing something new, do we?
Yeah.
So, and you know, although it may seem like breastfeeding comes natural, really it doesn't. You know, hand expression doesn't come natural. A lot of these things, it doesn't come natural. And I'm just so glad that we have this position, and that I'm in this position to teach moms. And again, I just try to give new moms, old moms, veteran breastfeeding moms just grace along their journey. And we just try to segue. I like to come up with a plan. I like to meet patients where they are in their journey.
And this kind of segues into what you just said. In your experience, how does culture or generational knowledge influence how women approach breastfeeding?
Oh, there's so many factors to that, and that's such a loaded question. It just depends on what culture you come from. You know, I can speak to, you know, as an African American, I remember when I was breastfeeding, I breastfed my daughter for 3 years. You still got that baby breastfeeding? She's still breastfeeding. You know, whereas other cultures, you know, in other countries, they're breastfed for years and people don't bat an eye. It just depends on the culture you're from. Some cultures feel like the colostrum's dirty, or you need to drink, you know, hot chocolate to bring your milk in. Certain other, and I always like to respect those cultural differences. You know, provide culturally competent care in all of my patients. So if you feel like whatever, I'm not coming with evidence-based practice, as long as you know, I feel like it's not detriment, you know. But if you feel that, you know, hot chocolate or what have you will increase your milk supply, I'm going to give you hot chocolate, you know, because why not? You know, so again, providing culturally competent care. And I think that also comes down to, as well as meeting that mother or family where they are, relates to their own breastfeeding journey.
Yeah. Yeah, that's good information too, and good support basically. So you kind of not interfering, like you said. If there's no harm to it, then why not do what you can to support what it is that you know they believe in, as far
Exactly.
as that is
And
concerned.
I've never seen in my practice that something that they believe culturally has provided any type of harm to the baby at all. So I go along
Yeah,
with it
yeah,
completely.
yeah,
So
for sure. Now, what advice would you give to partners or support people to help them be more involved and informed in this, process?
well, I do oftentimes see that when I go in a room, sometimes I can tell the dynamic, right? Sometimes I feel like the dad wants, or the partner wants the mother to breastfeed more than the mother actually wants to breastfeed. So I always like to start with whoever's breastfeeding. What do you want to do? Tell me what your plan
Yeah,
is. Sometimes I look to the dad or wherever else. So I always like to start there. What do you want to do? And let's
yeah,
go from there, because there's no need in me, spitting out all these things, evidence based. This is what you should do. Again, meeting that patient where they are. What do you want to do?
yes. Hmm.
Because it just depends by family. It's not even just by culture. It's just really by family. So
Yeah.
just meeting them where they are.
Hmm. Hmm. Now, let's talk about the return to work transition. How do you help women prepare to continue their breastfeeding journey while managing jobs, pumping, and childcare?
Yeah, good question. So I prepare for that in the hospital, and then one of the biggest
Hmm.
things I like to tell mothers is making sure you're introducing a bottle of breast milk by weeks 3 to 4-ish, about 1 to 2 times a week. Because,
Hmm.
especially in the moms that may not be returning to work, or they may be returning to work after 12 weeks, and sometimes they'll think they'll introduce that bottle right before they go back to work.
Hmm.
Unbeknownst to them, typically after 6 weeks, it's very challenging to introduce a bottle to a baby, even if the baby had a bottle the first week or two. It'll get used
Yeah.
to breastfeeding, that suck pattern. And then after that suck reflex is kind of integrated, they're not really into
Yeah.
learning new things. So it starts in the
Hmm.
hospital for me. I say by weeks 3 to 4, introduce a bottle of breast milk or what you decide to give the baby by weeks 3 to 4, one
Yeah.
to two times a week. Pace bottle feeding to match the flow of your breast milk. So not letting the baby chug the milk, just trying to pace 10 to 20 minutes on the
Yeah.
nipple. It's really about a flow preference, not a nipple confusion. So that's the biggest thing transitioning to work. I like to teach right in the postpartum period because
Yes.
it comes so quickly. 3 to 4 weeks old,
Hmm.
at sleep deprivation, you turn around the baby 6 weeks. So I'm like, if you
Yes.
can set an alarm, just remember, please introduce this because we get so many calls to
Hmm.
our office. The baby won't take a bottle, and I can give you some tips, but I'm not the bottle feeding specialist. There are some bottle feeding specialists, also IBCLC, but it's typically a
Yes.
speech language pathologist that will handle those cases.
Yes.
But that's the biggest thing. And then also educating on pumping, letting the mothers know the laws as far as pumping and their rights to pumping, typically the first year.
Yeah, that was my next question. Like, what's your guidance on pumping, and then also, are there any myths that you like to bust regarding that? So go on and talk about pumping. Yes,
Yeah, so I
continue.
always like to, and it's hard in this social media age because there's so many influencers that may not be educated. They may just be mothers themselves, and they're showing all these, oh, look, I got 12, 13 ounces of milk, and can make other mothers feel inadequate, and
Yeah,
things such as that, or they're having a wearable pump, things like that. So I always like to educate in the hospital. It's my questions always ask, what type of pumps do you have at home, pump or
hmm,
pumps.
hmm,
So making sure they have a strong pump at home to be able to adequately remove that milk, because it's all typically supply and demand. What you remove will be replaced. So typically, some wearable pumps do not effectively remove that milk that's needed. So I always try to say, when you go back to work, try to stick with a nice strong double electric pump, wearable pump as needed, but make sure you get what your baseline is. So if you're used to removing 5 ounces with your Spectra, make sure you get that same amount with your wearable pump as well. And Spectra is just a brand of pump.
Okay. What is a wearable pump?
So, I mean, that wasn't around when I had, my daughter's 15. That wasn't around. I had a Medela. And I didn't have the right flange. I would pump it. I didn't get anything. And I was like, what's wrong? And I still tell my patients that story. I'm like, but there's so many, there's so many things involved in that. So a wearable pump is a pump that is portable, that doesn't require it to be plugged into the wall. You just put it in your bra and it will suck the milk out.
What?
Yes.
Like,
you just put it in your
wash
bra.
the
It's super
dishes.
discreet. You won't even know that it's in there typically. I mean, it will look a little, off, but you don't have to be plugged up. It will suck the milk out in your bra. So a lot of moms like to use it as they're driving, at work, work from home. The milk will just be sucked out.
And where does it get? I mean, where does it put in the milk at?
So it's like typically like an egg-shaped device. There will be like a center, a tunnel. It's usually like a 24 mm tunnel, which is too big for most moms, and they'll need an insert.
Yes.
But it'll collect into the device itself. So it's a portable device.
Yes.
So it'll collect into like a bag or just a container that's part of that portable device.
Wow.
But
man, they come up with everything.
they're not always as strong as that plug-in pump. I know you probably remember the Medela pump. There's new pumps out that I like a little bit better than the Medela itself, but I digress. The wearable pumps, there's different wearable pumps. Some of them, $500, things like that are, can be a little bit more effective at removing the milk. But I always just try to educate and have moms know, just to be cautious with using them. Okay. But also, they serve a purpose. I'd rather use that than not pump at all.
Now, again, I don't know if you read my mind with these questions, but you're segueing into some of these. And so, what tools, apps, or resources do you recommend to moms trying to build a successful feeding routine?
So I like to recommend, especially in this digital age, apps. There's various apps to track pees, poos, memories, pump volumes, things such as that. There's like a Huckleberry app. There's so many apps that you can download from the App Store to track babies' pees and poos. Because I don't remember tracking that. I mean, maybe it's gone out of my mind from 15 years ago, but I don't remember anyone telling me to track anything. I do remember my lactation consultant that came in to help me breastfeed my daughter for the first time. But as far as apps, I don't remember anyone teaching me to track these things. But I like to tell moms to use apps to track volumes and pees and poos.
Yeah. So, all right. Well, that is certainly some good information there. Now, Sonja, you're studying to become a nurse practitioner. What inspired you to take that next step? And I guess what's not here and what I want to add on to that, what's going to be your area of focus? And so.
Good question, and I still am unsure. I do know that I love maternal health, lactation, but I also just love learning. I do miss working with various populations, so I am studying to become a family nurse practitioner, so womb to the tomb I can treat and diagnose, so this is why I decided to become a family nurse practitioner. I just knew that with my current role, I wanted to do more. I wanted to be able to do more, especially like I said, I'm limited to, I can't diagnose, I can't do certain things. So
Yes.
I'd at least be able to do that in this realm. But, you know, to me, the world is my playground. I want to be able to do whatever my heart desires. I have so many different, you know, areas I want to just delve into. I just want to help everybody. So I just
Yeah.
like to learn all different aspects. I've kind of been everywhere
Yeah.
doing things. So
Oh, that's cool. That's cool. Now, where do you see the future of lactation care heading in healthcare? And what changes are still needed?
the future of lactation care. Honestly, that's a good question. So honestly, I don't know. I'm hoping that we will, for one, at least with the pump companies, they'll start providing smaller flanges for moms. And
Yes.
most pumps, it comes with a standard 24. Maybe you'll get a 21 flange. I haven't.
Now, sorry to interrupt you, but I must say, what is the significance of the flange, basically? I mean, what is it, you know, I mean, your desire is that they provide a smaller one. I mean, what's the significance of it? Help us to understand.
Yeah, good question. So the flange size is, I don't know if you've pumped at all or remember pumping, but
Yeah.
typically it comes with like a one size fits all. Like, okay, this,
Mm-hmm.
I'll say the 24 flange is about this size. So
Mm-hmm.
ideally, we want the flange to really grab the nipple, not the areola tissue. So
Ah,
not everyone's nipple
so
is
it needs
this
to be
size.
narrow.
Okay, and this is typically
Yeah.
a size, I say, of a 24 flange, probably about that. Okay,
So that's your whole areola, like you
and
saying,
it just
basically.
depends. I've seen it, you know, it just
Yeah.
depends. So
Yeah,
this
they're
is the
very.
thing. When they just do, I've rarely measured moms, and I measure all of my patients. Typical size is, I'd say, average 17, 19, and they did just publish an article that said that the typical size is a 17 millimeter flange. So the flange
Yes.
matters because it's more comfortable for the mother or
Hear
pumping
that?
person.
Flinch matters.
Yes, the flange matters. And that's actually,
Flange matters.
I think that's like an article I remember reading. The flange matters.
Yeah.
And it increases the supply, what you're able to extract from the breast.
Oh, okay.
So
Okay.
when you have a flange that's too large, meaning if it's sucking all in that areola tissue, it's very sensitive. It's more
Mm-hmm.
uncomfortable, and you're not able to get as much as you could. It increase risk of
Mm-hmm.
clogged ducts and things such as that. Clogged ducts can lead to mastitis. So it's kind of a trickle down effect with that. So I'm hoping that soon these pump companies will start to have smaller flanges, or actually
Yes.
make smaller flanges. We have to buy
Mhm.
off-label flanges to match that are compatible, but they're not the brand of the pump.
Yes. Okay. Okay. So, Sonja, as we wrap up, if you could say one thing to a new mom struggling with breastfeeding today, what would it be?
I always say give yourself grace, honestly,
Mm-hmm.
because so many mothers are, frustrated, and, they're thinking
Mm-hmm.
that they have to get this latch perfect right now. Just knowing that first 24 hours, the babies are super sleepy. Just really that education prior to, I'd like to really, if I can, reach them before they even go into labor to, that anticipatory guidance. Guide them to,
Yes.
this is what could happen. The second night, the baby's
Mm-hmm.
going to cluster feed. You're going to feel that you're not enough, that baby's not getting enough milk. They all do this. It's normal. That
Yes.
helps bring that milk supply in. So
Yes.
just really to give yourself grace, reach out to an IBCLC in your community prior to delivery to try to, especially if breastfeeding is your goal, to just get some of that education, because once the baby's here, sometimes it's difficult to absorb that information in the moment. Baby
Yes.
screaming, things such as that. So just give yourself
Yes.
grace.
Well, cool. Well, what a rich nourishing conversation.
Oh, I see what you did there.
A huge thank you to Sonja Howie for gracing us with her knowledge, her heart, and her advocacy for mothers and babies. Lactation isn't just a biological function, it's a relationship, a rhythm, a journey. And Sonja reminded us just how powerful that journey can be when it's supported with skill and compassion. If today's episode lit a spark for you or someone you love, share it, save it, and don't be shy. Revisit this one during those late night feed sessions. This has been another episode of Science Me on Lorie Out Loud, where we make the science of our lives make sense. Until next time, take care of yourselves and each other. I'm Lorie Jean Akanbi.
Lorie out loud.